Hey team, Tony here again at Stagecoach Pharmacy, going over another frequent question that I get a lot here at the pharmacy, and this is about the GLP-1 analogs. So the Wegovys, Mounjaros, Zepbound, semaglutides, compounded options. Question I got today was, is the compounded option as effective as the one that is approved by the FDA? It's not that it's not as effective, it is cheaper, but you do run the risk of having more adverse effects. Anything that's going to be produced or manufactured with FDA approval is going to have more rigorous testing. Now, if you need a GLP-1 analog like Zepbound or Wegovy or Mounjaro, and you can't afford the brand name ones or it's not covered on your insurance, then the compounded options are a good alternative. But I tell patients as much as possible that anything that is FDA approved is going to be safer, which is also why it's going to be more expensive as well. It's not always covered on insurance, and many times patients are paying out of pocket. There's nothing wrong with these medications. These are great medications and they help people tremendously. A lot of people have asthma, they have lower limb injuries, they have other factors that are not allowing them to exercise. Maybe it's a nutrition component, maybe they need more knowledge on nutrition. What I tell as many patients as possible is that having a healthy life and a healthy lifestyle and having the fitness that you desire or expect is a component of three things. So the first thing in this case is going to be the therapy. So if you need a GLP-1 analog, don't ignore the gifts that society is giving you or some other medication. If it's available, use it to your advantage. The second thing I tell people is they're going to need some sort of nutrition coaching, counseling. I always recommend looking for someone with a master's degree, a dietitian, someone who has the right education. And this person is going to be the best suited person to help you learn your body. That's essentially what you're trying to do. Nothing wrong with diets. Those are a great thing to jumpstart with, but the ultimate goal is you getting in touch with your body and what your body needs and how to listen to your body to make the best decisions that are for you. So again, nothing wrong with diets. These are a great starting place, but where you ultimately want to end is getting to know your body. And that's why I think it's very important, in addition to the therapy, to making sure you find someone who can meet with you weekly, bi-weekly, once a month. Generally, it's going to be 9 to 12 sessions. They're going to ask you to do things like record what you're eating, describing how that makes you feel. They're going to give you some foundation understanding on fats, proteins, carbohydrates, and understanding how to combine those to really optimize what's best for you, your body type. You might be pregnant, you might be younger, you might be older. Your nutritional needs are going to be unique to you, and someone who has the right education is going to be best suited helping you there. And the third component that we need to talk about is also exercise or movement. It doesn't have to be going to the gym. Maybe you like gardening, maybe you like yard work, maybe you like some other form of activity that provides you what you need. So I tell people those three pillars are typically what's most important. The right therapy, the right nutrition, which generally comes with some form of education, and the last thing is making sure that you have some sort of physical activity. So I think of those three things as the legs to a chair, right? So GLP-1 analogs, great medications. We dispense a lot of them here at Stagecoach Pharmacy, and they help a lot of people. And when they're in that journey and they're getting started with that journey, I always try and discuss with them the importance of finding someone who is separate from their doctor, who's knowledgeable and has the right certifications on nutrition, who can help them figure out what they need to provide for their body. And the third component I talk about is fitness. And I encourage people to make sure that their doctor is a different person than their nutritionist, who's a different person than the person who's educating them about exercise. This is going to allow them to make sure they have someone who's not biased and gives them everything they need and all the tools that they're going to need in their kit to be successful, not just in the short run, but for the rest of their life. If you have any questions here at Stagecoach Pharmacy, my name's Tony. You'll talk to either me or Leo. Happy to help you answer some of those questions, help you figure out what's best for you. Take care, team.